It's great to be back here at Cambridge Memorial Hospital. Thank you for coming out. I want to begin by acknowledging my colleagues. Two of my colleagues are here from the legislature. Rob Leone, of course, your local MPP, Michael Harris from Kitchner, Conestoga, and I know Jeremy's here representing Elizabeth Whitmer. So it's great to have you out, combined with all the community leaders, local politicians, and others who are here, and of course the folks from the hospital. Many of you were here last August when our colleague Deb Matthews, the Minister of Health, was here to make a very, very exciting announcement that we were moving ahead with the Cambridge Memorial Hospital redevelopment project. I think it's quite an understatement to say that this project has had a fair amount of community support and enthusiasm, and I've got to tell you that it's not simply here in Cambridge where the hospital has become such a symbol and a rallying point for the community, but it's throughout the entire region and throughout the entire LHIN, because Cambridge Memorial Hospital is very much part of a larger health infrastructure. And I'm so pleased that we have Joan Fisk, the chair of the LHIN, who's here, Bruce Lochner, and other folks from the LHIN, because they've done so much to transform the various hospitals and various healthcare services here in Waterloo, Wellington, into this coherent system which puts patients first. I also, of course, want to commend Patrick for his leadership here at Cambridge Memorial Hospital. He's been, I think we would all agree, a transformative leader who's done so much to expand and improve patient services and been in charge of a wonderful team supported by a great board of volunteers. And of course, a special thanks has to go to everyone who works here at the hospital, the volunteers, the medical staff, all the staff who work so hard and do such a wonderful job, and as I say, contribute to this overall healthcare infrastructure. Now, a few weeks ago, all eyes in the region, at least maybe in the media, were on Cambridge Memorial Hospital as we prepared for our provincial budget. Everyone expected a tough budget, and in fact, when the budget was delivered, it was tough because we're in very tough times. But we made a decision as a government that although we were going to have to take some strong measures, we in no way wanted to move backwards when it came to the areas of education and healthcare. Ensuring excellence in healthcare meant continuing the services and the transformation that's going on. It also means ensuring that we have the proper infrastructure to support patient services and make sure that individuals are getting quality of care. That means going ahead with projects, including the one here at Cambridge. And I'm here today, maybe as a bit of an update, to tell you that not only is the province fully committed, not only is I got to do it differently for Sarah, I got to do it again for CKCO. Not only is the province fully committed to the redevelopment of Cambridge Memorial Hospital, but I'm here today to announce that we will be making a further $4.3 million available to the hospital to help with its planning and development as it moves forward with this project. Now, combined with the previously announced $10 million, that means that the hospital now has $14.3 million available to it to finish the planning, finish the design, get the tenders out the door, and get shovels in the ground. So I want to congratulate Cambridge Memorial Hospital, sorry to drop this, and talk about what some of the results will mean for this community and for this hospital. We will have an improved, modernized hospital facility for patients as well as those in the surrounding areas, Waterloo, Wellington. More babies can be born closer to home. Less time will be spent waiting in an ER that will soon be able to see over 20% more patients. We'll have improved patient health and safety, and this means that residents will get the care they need when they need it most, with up to an additional 47 new beds. So I want you to know that our government is committed to healthcare infrastructure. We know how important it is to patients, to their families, and most of all, how important it is to this community. Through your hard work and commitment, we've seen this project come to light, and we're going to see it through to fruition. And I want to close by thanking all the partners, many of whom are represented here today. The region of Waterloo, and Chair Ken Sealing is here today, which of course through One Voice, One Vision has been such a great supporter of not only Cambridge Memorial Hospital, but all the region's hospitals. I want to thank the City of Cambridge and congratulate them. And Carl Kiefer's here. I know a number of the councillors are here. Pam, oh, I'm going to get in trouble. Pam Wolf. They're all Cambridge councillors. I got to Pam Wolf.
Frank Montero.
Okay, Craig Montero. Frank Montero. I'm from Kitchner. So, Donna Reed. So I want to thank. Oh. All right, I want to thank all the Cambridge councillors and the commitment of Cambridge, the financial commitment, as well, of course, the community leadership. I think this is a real testament to this community. Great things are happening here at Cambridge Memorial Hospital, and we're going to see great things as we move forward. So once again, thank you all for coming out here this morning. And to Patrick and his team, congratulations, and I know these resources will go a long way to making sure that this project comes to fruition. Thank you.